Welcome to the Get Smart with Money podcast. I'm your host, Dana Hernandez, financial planner and author of Get Smart with Money, Break Free from the Struggle, Build Wealth on Your Terms, and Rewrite Your Money Story. Here we talk about money, entrepreneurship, growth, and resilience, because financial freedom is about more than just numbers. Each week, you'll get practical strategies, inspiring stories, and the motivation you need to stress less about money and create more freedom in your life. Let's get smart with money together. Hey everybody, welcome back to the show. Today I'm here with Logan Wright. She's a licensed clinical social worker. She's the owner of Family Forward Therapy, a private practice in Reno, Nevada that serves many children, teens, and young adults. Hey Logan, how you doing today?
I'm good. Thanks for having me.
Yeah, you're welcome. So I've been looking forward to this interview because I love that we're in the same area and your whole line of work is interesting to me. And I don't have any kids, but I know that this can help a lot of people that do have kids. And so you said before we did this that you're from Reno, you said, but then you moved to Washington for a while and now you're back in Reno?
Yeah, so I was born and raised in Reno. And then I moved to Seattle to attend the University of Washington for my undergrad degree. And then after I did my undergrad, I moved to Spokane, Washington, where I did my graduate degree. I got my master's in social work. And I started out my professional career in Spokane. I worked for a group practice up there for about 5 years. And then we moved back to Reno in the fall of 2021. So we've been back here for a little over a year.
Right on. Okay. So what are 3 words that you think best describe you?
So I loved this question because it got me reflecting a little bit about on myself, which I don't do enough, it seems, but I would say I really feel I'm empathetic. I think that's a huge trait of a, mental health therapist in general, but it's something that I really value about myself. I feel I'm pretty analytical. I'm definitely a problem solver. I like to put pieces together to kind of solve the problem. So, and then the last word that I would use to describe myself is personable. I feel like I can, bring a warm and inviting, aura, I guess, to our environment and to our sessions.
Awesome.
Yeah, those are the 3 words. Yeah.
Cool. Yeah, no, I agree with you. It's been cool talking to you so far.
Yeah, thanks.
And so why do you like helping kids? What's your driving force? What's your whole driving force towards helping kids?
Yeah. So there is no question in my mind that my passion lies in working with kids. From middle school or high school, I knew I wanted to work with kids. I think that has been for, many, many reasons, but one of the reasons I enjoy working with kids is because I feel like the work we're doing together is kind of in the upstream mentality, where I feel like we're kind of truly changing their life path, and hopefully into a really healthy and positive way. So I really feel like, working with kids is so essential, so needed, and just really fulfilling. And then I also like working with kids because in session, we are really creative, we play, and that it keeps it fun. It keeps the days fun. Kids are also really hilarious little beings and, make me laugh. So in every kind of way, shape, and form, I just have really loved working with kids.
That's nice. Oh man. Yeah, kids are hilarious.
They are hilarious. They are funny. I would say a challenging part, I guess, of working with kids, because every population has, their challenging points, but is that they do keep you on your toes. Like you have to always kind of be problem solving in session because, like never, things don't always, well, rarely go as planned with kids. And so I'll have like a plan for the session and then we have to divert and go like, a totally different direction, which is part of, the challenge that I love, but it also keeps it, difficult sometimes. So yeah, I mean, it is my passion. It's not all like, butterflies and rainbows, but it is truly wonderful.
Yeah. I love how every kid on every continent is essentially the same. They're all goofy and like they don't care. They're just in the kid mentality because, they can dream from that mentality. And then when we grow up, those dreams kind of go away sometimes.
I know it is a really interesting exercise. Like, to be imaginative, like when I'm in session with kiddos, like their imagination usually is at a really cool stage, like in childhood. And we kind of lose that as we get older. And so it's been, like it's a brain challenge to try to like get into that imaginative state with them sometimes because it's not something that my brain is not very strong at as I've gotten older, but it is so cool. Like you just experience life in such a different way when you can imagine and create, and it's just really cool.
Yeah. And so I do like to ask a question about COVID with everybody because COVID was such a life changing or defining kind of moment for a lot of people. So what is the most common trauma that you see in patients today, and has COVID had any effect on that?
So, yes, of course, like COVID has had an effect on virtually, pretty much everything. Kids have been significantly impacted. So I would say, getting back to your question about what's the most common form of trauma that I see. So in my practice here in Reno, I primarily see kiddos with the diagnoses of like anxiety and depression. And I do have, children that have experienced trauma on my caseload, and mainly that form of trauma is related to like domestic violence or separation or divorce. So that is kind of my current caseload. When I worked up in Washington, we were contracted with the child welfare system. In Washington, it's called the DCYF, and here in Nevada, it's called something different. So I just say the child welfare system, but in Washington, most of my kiddos that I was treating had trauma from abuse and neglect. And then also I had a big population of my caseload that was, pre-adoptive or adoption, post-adoption. And so we did a lot of there was a lot of attachment trauma. So my kind of client focus has shifted significantly from Washington to Nevada. I really enjoy, both kind of like caseloads, but just kind of a different population currently down here in Reno for my practice. And yes, getting back to COVID, COVID affected all of kids and all of trauma. And so, trauma, yes, COVID affected when it comes to relationship trauma. There was a lot more, higher conflict in adult relationships, and kids saw that and witnessed it. But then also on the flip side, like specifically with anxiety, because I see a lot of my population right now has pediatric anxiety, and that was significantly, changed due to COVID. And so children's mental health is definitely in a different place now than it was pre-COVID.
Yeah, that's sad.
Mm-hmm.
Jeez.
Yep.
And you said your clientele is different here from Washington?
Mm-hmm. Yes, because in Washington, the practice that I worked at, we were directly working with children involved in the foster care system. So, we saw a lot of abuse, neglect, and down here in Nevada, I don't directly work with the foster care system. I doesn't mean that I don't have kiddos that I see that, don't have trauma or don't have abuse and neglect history, but I don't, get direct referrals from the child welfare system here in Nevada. So just my population is different. Yeah.
Okay.
Mm-hmm.
And did you say before, when we were talking before this, at some point you said you wanted to maybe go back into helping the foster system?
Yes, I really enjoyed working with that population for a few reasons. A lot of my training early in my career was, to process through complex trauma and PTSD. And that was a skill that I felt really strong at. It was really rewarding work. I felt like children's resiliency was really showing, and they could be more successful at school or in social relationships, or, so many different areas of their life. So I would like to treat that population again at some point. I'm not sure when I'll be ready for family forward therapy to kind of take that next step and get more connected with that population. But yeah, not something that is happening right now, but I do see that in our future.
Okay. Yeah, no, I have a really soft spot for foster kids too.
Yes.
I would like to definitely have one of them or two of them or whatever happens in the future.
Mm-hmm.
I'm trying to find something probably for later this year, something I can volunteer with and do some sort of organization or something, because yeah, those kids have it rough.
Mm-hmm. So. Yes. Yeah. And it's, a growing area of need, especially. The other thing that I loved working with that population, I did some parenting services with parents that were either kind of at risk of their kids getting, removed, or didn't have kids in their care at that time, and were wanting their kids to return home. I did different parenting services, and I really enjoyed that because I was doing so much trauma work in my office, and I felt like I was just a little bit putting out the fires instead of trying to prevent them from happening. So I did also working with parents and doing some different parenting services to build their skills so that trauma doesn't happen in the first place. Yeah. So some point I would like to get back to doing that work. Just need to figure out when is a good time. And yeah.
Okay.
There's so many ways to impact our world a little bit. And of course, I have a soft spot in my heart for kids. So any way I try to impact the world is through kids. But I mean, there's so many areas of need. It's if you get caught up in thought, it can be a bit overwhelming.
Yeah, it's where do you start?
Right. Yeah.
Poor kiddos.
I know. Just such little control over what's happening in their life, and it's filled with a lot of hard.
Yeah, and they have to just kind of roll with it, and it's
Mm-hmm.
their parents don't know what they're even doing,
No, I know. It is an interesting thing now, for me being a parent and realizing that I definitely don't have all of my stuff, figured out. Parents aren't given this handbook. Parents don't, we figure it out too. And being a kid, I remember feeling like my parents had it all figured out, they I'm that is not at all how it works. It's just an interesting perspective shift now being a parent. I'm oh, yeah, I have a lot to learn.
That's funny. I'm sure I'll kind of be there too. Luckily, I have a whole team of people behind me with the financial stuff. So I'm sure I'll get help. And we do a lot of mental and self-development as well, because you have to work on yourself before you go and help serve other people with finances and things like that.
Right.
And even to be a good wife, sister, friend, you have to be okay and good with yourself before you can help and be the person that you need to be for other people.
Right. Totally. Yep.
Yeah.
And we all have work to do, it's a lifelong process to just become more solid, within yourself. And it's, constant, evolving process. Constantly evolving process. Yeah, that's how you word it.
Yeah. We're definitely growing all the time.
Yes. It's a cool thing.
Yeah. And what advice would you have for anybody in a toxic relationship or roommate situation with kids?
So I think first and foremost, societally, there's kind of this misconception that children, particularly like young children, don't remember things from early childhood. So like I've, heard so many times in my practice, like, oh, but he was only 2. There's no way he can remember. And my advice for parents is that like kids do remember, that kids' working memory, like their cognitive memory starts around, the age of 3. But prior to that, our brain and body stores all of those memories more physiologically. So there's like a plethora of research now showing just how trauma impacts kids' brain structure and function. So I think that my advice to parents would be like, although, single incident traumas can be absolutely devastating and impactful, we know that prolonged chronic trauma and stress is highly concerning when we think about like kids' brain development and function and their body system function. Like our stress response systems get altered and changed with chronic and prolonged stress. And so if a parent is in a toxic roommate situation or a toxic relationship, I think like the sooner the parent and kids can find felt safety, like the better, because we just need kind of that prolonged trauma to stop. We just need it to stop, so then we can start to heal and process and all of that. So that would be my advice. Is it's when you realize that it's not healthy and not a healthy environment for you or for kids, to do something about it, because the longer that continues, the more it impacts and changes kids' brain and body for like the rest of their life.
Yeah, I definitely agree.
Yes. And the other thing that I would say is we know that with trauma and, chronic stress, kids also start to develop these things called cognitive distortions, which is, kids might say like, well, if I would have done this, then that wouldn't have happened. Or it was my job to protect you and I failed, right? Like kids start to, because kids are pretty egocentric in nature, just that's where they're at in their development. Kids really start to tie themselves to some of these harder, scary things, even though oftentimes it has nothing to do with them, right? And they are not the cause of this hard and scary stuff. It's unfortunately they have to live in it, but it's not their fault. But they start to kind of get these cognitive distortions that it is. And so that would be another kind of advice point that I would have for parents, is just to notice and watch for that and try to correct and like seek treatment if they're noticing this stuff, because it can really, that changes how kids, feel about themselves, how they feel about the world, how they're able to build relationships in the future. It changes so much about their little social and emotional being. And so those need to be like corrected kind of as soon as possible.
Yeah. Wow.
Yeah, I know. And I can happy to go into more detail about like how it changes kind of the brain structure and function. I don't know how in depth you want me to get, but I can keep going if you would like.
Yeah, that would be awesome. But I do want to say that I definitely agree with parents needing to get out of that situation for their kids, because it not only affects kids, but it affects your pets too, if you have pets. Because I had a dog through all my roommate situations, and she's still got trauma from that. And luckily, like, we're in a really good house now. She's got a brother now, and I'm with somebody that's amazing, and so all that's over. But like, I definitely saw the trauma happening with her, and I could have stayed with the guy, even though I knew it was toxic for me. He was crazy. Mm-hmm. And I was like, if not for me, then for my dog. because it was
Yeah.
just awful. I couldn't get him to stop treating her like shit. It was just terrible. And
Yeah.
she was like a year old, maybe not even at the time. And I was like, I have to get out. And then, you know, one bad roommate situation after the next, and some were easier than that one than others. And the last one we were in was awful, and like her and her brother were not happy, and it was just very obvious.
Yeah.
So we had to get out of that one even sooner. So we were actually paying on 2 apartments because we had to leave that one, and we didn't break the lease or anything.
Oh man.
Yeah. So but for us and for them, we had to get out.
Yes. Right. It was, I mean, you're right. Like that was absolutely the right decision for you guys and for your dogs. And it is amazing, right? How animals are so tuned with us and so connected to us, and they feel stuff too, and they feed off of us. So you were probably in a really high state of stress, and they could feel that. I mean, they were experiencing it too, but they could also feel that off of you. And that is scary. You know, when people depend on you, it's scary to see the person you depend on, like, not functioning well.
Exactly. And not themselves like every day. So.
Right. Yeah. Oh, I'm really sorry to hear that. That sounds hard, really hard.
Yeah. So I don't want to be the person to be like, you know, you think roommates could be like a good way to save money, which I mean, it could be, but it's also very possible that it's going to cause a lot of stress for you in your life, because if you don't have good communication with this person, even though you think you do, they might be your best friend that you're going to go live with, but you're probably not going to be best friends anymore after a while. So it's just a lot of things to consider when you do live with people you've never lived with before.
Mm-hmm. Totally. It's a complex, it seems, you know, when we're making that decision, it doesn't always bring like all of the complexity, like the layers to it that we need to think about. But then when you get in there, you see like, oh yeah, there's a lot of layers to this that we can, like, you know, jive on, you know, 6 different things. But if there's conflict within 1 or 2 of those dynamics, it can be really disruptive.
Yeah, exactly. Like my last one, we had like laundry fights. We had light fights because she would always leave the lights on, and every time I'd go by, I'd flip them off. And the AC fights and dishes fights. It's just like all this passive aggressive stuff, like, and it's horrible. Like it's like the other person will not have like house etiquette, but you do, and it's the hardest thing to get through.
It is so it is so hard. I know everybody has their different viewpoints and stuff about like living with partners, you know, before like you enter into like a long-term relationship or a marriage or commitment with them. And personally, I'm a huge fan because I feel like there's so much that you have to work through when you live with somebody, whether it's just a friend or a romantic partner. There's a lot that you have to learn about them and work through. So it's complex.
It is. Yeah. When you really think about like all the things that can happen. Yeah.
Mm-hmm. Yeah.
But, and then, so get back into how it really affects the kids' minds and everything.
Yeah, so I won't go too deep. There's so much anatomy talk that we could get into, but I guess just to basically kind of highlight the different parts of the brain and body that it can change and alter, is that like chronic trauma and stress can result in long-term dysregulation. So the system doesn't work properly, and long-term dysregulation of the norepinephrine and cortisol systems. So your stress response system, right? Like those are the systems that kind of like fuel your body to, you know, for survival, but also like, you know, pump those good kind of hormones that in small doses is really like helpful for our function. and really like healthy for our body. Like small doses of that is what we need. And that's why we have those systems, but it can cause long-term dysregulation in those systems, which is really unhealthy. It's really unhealthy for those systems. It's really unhealthy for our body, for our brain. And so then and other changes that can happen in the brain specifically is it starts to change the brain regions, of like the hippocampus, the amygdala, and the prefrontal cortex. So really big parts of the brain, really important parts of the brain, for learning, for memory, for, I can go on and on and on about like what these parts of the brain are used for, but it changes all of that. So when you just think about that trauma and stress, it changes your brain, and it changes how your brain is able to function, how it's able to, you just think about like the long-term impacts of that, right? It might look so small scale when kids are little. As they're growing and they're in school and they, like their trajectory is going to look different than similarly, aged peers that didn't have trauma and stress. So it just is we are gaining more and more research all of the time in this area, because I think for so long we didn't know a lot, and now we know so much about this. It's really frightening, like how different it causes your life trajectory to be when these parts of your brain are altered. It makes it so much harder to live,
Definitely.
Yeah. So I don't want to go into more detail because I feel like that will get too anatomy-y, but it's just to give a little bit of content that it does change brain, regions and your kind of stress response systems. So
makes sense.
Yeah. Crazy.
Yeah, it is crazy. And people don't think about that because, like, you're in the moment and it's like you're the adult. You make the decisions and it's like, oh, this is just my kid. Like, I love them, but I'm going through all this and, I need to make the decisions. And they're just wrapped up in the emotions of what's going on. But then they also really need to think about what's going on in the kid's head. It's really important to have that communication with your kid during those times. Especially.
Yeah, I think a huge part of, being a parent is trying to enter into your kid's world and understand what's going on in their little world, right? I think we as adults have so much, our brain development is in a much different spot. So we understand things differently than kids do, but also we have so much life experience to kind of like, give us more information. But kids don't have that. They, their brain development is different. They also don't have any, very little life experience. So I think an important role of a parent is like to try to enter into your kid's world and understand how something might be impacting them, understand how they might be, responding to something, like why that might be happening. There's always reasons underneath kids' behaviors. If your kid's not, if your kid is like having a lot of tantrums, or, high moments of dysregulation, or if they're having, really hard time following instruction, like there's reasons for that. There's always reasons underneath kids' behaviors. It's not just because they want to be defiant. Kids don't want to be defiant in nature generally. There's reasons underneath that. And so we need to like investigate. It's our job, I think, as parents to really try to understand that, and not just label them as like, bad or lazy or defiant. That's just not helpful for kids. It doesn't solve the problem.
Yeah, neither does like prescription drugs or anything like that.
Right. Which
I feel is like a shortcut that a lot of people take, like even I have a couple cousins that they always seem to be like drugged up on something, and they were young.
Yeah. Yes. I mean, yeah, it's a whole nother can of worms, but yeah, I mean and just understanding, I think in kids, because mental health is, for so long, I think children's mental health wasn't something that people really thought existed.
Yeah.
That, and now obviously I think, we're coming to know that children do have anxiety, children do have depression, right? And all of those things look very different. They present differently in kids versus adults. In kids, it is can look a lot more behavioral. In adults, it might not look more behavioral. It might look, that it might be just a felt thing that they experience them a little bit more silently. I mean, sometimes. And I think now we're understanding that, kids do struggle with mental health stuff. Often, there is like organic components to mental health, of course. But there also is environmental components. So anyway, I think now that children's mental health stuff is more recognized, I think though there still is a lot of misdiagnosis of what's going on. I think ADHD, a lot of people know that's a pretty perfect example. We had a era where ADHD was like being diagnosed so often. And now we understand that like, oh yeah, probably wasn't ADHD, probably was depression or was anxiety or, was trauma or like a bunch of other stuff. There's so many things that can impact kids functioning. But, so I think now kind of our work is about like providing accurate diagnoses for kids and providing options. Like, because your kid has ADHD, it doesn't mean that they have to get on, stimulant or they have to be on medication. We can try these other things. We can go to therapy. We can, try occupational therapy. We can do these things first. You can exhaust these resources first. And if functioning is still impacted, and then, we can look at other things. It might be changing schools, right? It might be changing environments, changing, a lot of things doesn't always have to result in medication. Sometimes medication is necessary, for some kids, but it's not something that should be our first response always,
Yeah, exactly.
Yeah.
Yeah, definitely. Geez. Poor kiddos, man.
I know. Gosh, I know. But I do feel just that, we're understanding them better now than I think we have before. Which is a really wonderful thing, because when we understand what's going on, for them, I think, and in their brains, we can treat it better. So I do feel like, gosh, it's really wonderful, like the direction we're heading and just understanding, pediatric mental health. But there's a long ways to go still. And it's a generational thing, right? There's so many people that still don't really believe that kids have mental health struggles.
Yeah.
Yeah,
it's really crazy.
We'll get there, and I think it's just going to take time and more attention around this, like more media attention, more research attention, just more information, I think will help get a population kind of this information.
I think so. I've recorded an episode with my boyfriend because he's got ADHD, and I think I have like a slight touch of ADD, but it was never diagnosed. And like, we both feel like it's not talked about enough. There's nowhere near enough coverage for ADHD or anything like that, because people are still like, that's not a real thing,
Right.
So,
and I think, and then on the reverse, right, when we're talking kind of about kids right now, but I think I've seen a kind of a big thing recently, or a big trend recently, where there's a lot of adults that were misdiagnosed or not diagnosed with ADHD who are struggling in their adult life. Yes. And it's like hugely impactful still in your adult life. It's not just like a kid thing, but I think like people think that ADHD is just like a kid thing. It's not. It's definitely not. Something that adults struggle with too. And it is really hard to cope with and like figure life out if you don't have this understanding about how your brain works, So
it's crazy.
Interesting. Really interesting.
So if these parents are in a toxic situation, how would you say, or like, do you have tips on how they can communicate with their kids about these adult situations that are going on?
Yes. So I'll talk a little bit more generally, but then I think how you approach and communicate with kids is going to vary vastly depending on the kid's developmental stage and age. And also, what, is it a toxic roommate situation? Is it a toxic relationship? And if it's a toxic relationship, are both parents, are both adults the kids' parents, or is one their parent and one is, not related? How you obviously talk about that situation is going to vastly, is going to, oh my gosh, I can't find the words, but it's going to make a huge difference, because if it's your parent, then how you want to handle it is so different. So I'll get into that. But my advice on communicating like adult situations with kids is to, first of all, communicate. I think we we sometimes feel like, okay, if we just don't communicate, like maybe they don't feel it. I think a lot of parents are super good intentioned, right? And try to shield their kids from stress and trauma and what's going on in their adult life. Unfortunately, we can't always. I mean, we can shield them, we can protect them, but we can't totally like eliminate that from their life. Kids feel it. Kids are really perceptive, and so they feel it. They see it, even if they're not actively seeing fighting or conflict. They're such good observers, right? So that they're watching parents' body language, they're watching parents' sleeping cycles, they're watching parents eating, like they're always assessing us. Because they depend on us, right? It's part of their survival. We have to be functioning well for them to provide for them what they need. And if we're not, then that's super scary for them, because they couldn't survive in a world without us. And so, so I'd say always communicate with kids. That's super important. Children won't always be the first to talk about it. Sometimes they might, mention something in the car. Cars are really great times where kids bring things up because there's no direct eye contact. And so sometimes kids might bring stuff up. Sometimes, most of the time, kids don't. And so it falls on the parents to really take the lead on having these conversations. And as far as how to communicate, kind of like I said, it depends vastly on their developmental stage, but generally use language and examples that kids experience in their social lives at that time, right? So if, for example, like younger kids don't understand all the complexities to romantic relationships, that's just not a part of their world at that stage in their life. But they do understand friendship challenges, right? So you can explain kind of like this situation in that kind of like friendship language. So just to give an example, you could say something, and this is just very general, but you could say something of like, remember when you used to be really good friends with Sally, and then you guys got older and you guys no longer wanted to like do or, play with the same things at recess. And so you guys just realized that like, you don't really like to spend time together anymore. And like, it was harder to hang out than it was to be apart. So you guys just your friendship kind of ended. And you could use examples from their life and their little like friendship world to help explain kind of what's going on in the adult world. You don't want to go into really, a ton of detail. You also don't really want to talk, really badly about people, because kids will see that. And, but you can understand, kids will understand like that friendships don't work sometimes, or that friendships can have some really like some conflict, or when a friend didn't treat them, when the friend, was talking behind their back, right? How that made them feel. Like you can talk about that kind of stuff in friendship language, because young kids won't understand romantic relationships. If it's an older teen, that's different. Older teens usually and sometimes, will understand the complexity of romantic relationships, not like adults do, but they have a better grasp on that. So you can explain it to them. Your conversation with them might be, much different depending on, if it's a roommate situation, or a romantic relationship. Like I said, the conversation is going to be different. I also will add that there are ways to communicate with kids to use it as like kind of a teaching moment where, remember when you're in the living room and, the roommate said this to mommy and that made mommy sad. Like, people don't talk to each other that way. And that's why we're going to move, because people don't deserve to be treated that way. And I don't want you to feel like a friend can never treat you that way, because it's not okay. Right. And you can start to help them understand just boundaries and helping understand ways to kind of like protect themselves and to like kind of empower them to make different choices. So you can use it as teaching moments also. I will say, like, for domestic violence, that's a whole different, it's a whole different thing, right? If the parents are like, or if the adults are the kids' parents, then depending on the situation, some kids won't have contact with, the parent, who's the perpetrator, but sometimes, and a lot of times, kids do still have to have some form of contact with both parents, right? And so, that is going to be very different. You do not want to, talk really negatively about the parent to kids. It puts kids in a really, really hard spot. It really, that's a form of trauma too. And when kids, when parents are talking really negatively about back and forth about each other, kids don't feel safe then in either relationship with either parent. So it just creates a really negative situation for kids when parents talk badly about each other. So when that's happening, you don't want to talk negatively about somebody, but you could, about the other parent, but you could still reinforce kind of like that there were hard moments, and that mommy and daddy need to be in different houses now so that mommy and daddy can, make better choices and be happier and be more loving for, the kids. And you can talk about it in a way that's like, this is what needs to happen because of boundaries and health, but not talk negatively about each other. There's a way to do both. So I would just say, like, when it comes to parents in DV situations, to really kind of remember that, put boundaries in place, like explain to kids a little bit about what's going on, but please do not talk negatively about each other.
Yeah, agreed.
Yeah. Yeah. It's so common, right, in separation, divorce, DV, that kids are kind of used as these kind of like weapons to hurt the other parent. And like parents forget that these kids are like people, and it just is really heartbreaking, and kids can really, suffer from that.
Yeah. And it's easier to do. It's easier to bad talk. It's easier to use your kids as pawns like that. And it's just easier to be more negative. But if you stay a little more positive, a little more smart about how you talk to your kids in these situations, it's going to pay off in the future. And they're, they're going to grow up healthier in their mind and body and spirit. So.
Right. Yep. And the other thing I just would kind of reinforce is, when you're having these conversations with kids, you want to just make sure to like validate whatever feelings, whatever thoughts they share during these conversations. Often, I often get surprised in session. I'll ask kids when we're talking about something hard or, scary or some kind of trauma, I'll say, well, tell me what the hardest part was. And it is actually very amazing how what I would think what the hardest part was and what kids perceive as the hardest part are often very different. And so when we're having conversations with the kids, we have to validate whatever feelings kind of come up for them, because we don't know what it's like for them. We don't know what feelings they're experiencing, and truly, if they're experiencing anger or guilt or what, like, we have to just validate that, like, of course you're feeling that way, and it's okay to feel that way. Because like I said, I think kids interpret things much different than we do. And so we can't assume that we know what it's like for them.
Yeah.
Yeah. And then, of course, I'm a therapist, so huge advocate for therapy. When hard situations are happening, it's always good to get kiddos into individual therapy, family therapy, kind of whatever you're feeling is kind of the best route for the family. But just to, even if, I've had parents who are like, I think that like this didn't really they seem to be doing well in school. It seems they seem to be okay, but I just want to check. And like, we'll do, a couple of sessions, just assess for cognitive distortions, assess for like how they're doing, and they're good, right? And then they can kind of like, they don't have to see me anymore, but they can check in if they need to later. Like you can just do a check-in, you can just do an assessment and just see like, is my kid, functioning the way that they should be, or, are there some pieces that we need to heal and piece together again? I don't know. I'm a huge advocate for therapy, so I think it's great.
Okay. Yeah, I definitely agree. I like that whole checking in type thing you just said, because a lot of people don't think about checking their kids. Even, your kid could be carrying something from school and you don't know. Like a lot of kids don't tell their parents what goes on at school. There's a lot of secrets there, and it's important to at least have someone for the kid to go tell. If not the parents, then therapists would be the next best, I think. So
yeah. Yep. And I also, as kids change in their developmental stages, they understand life differently, they understand relationships differently. So it's very common, if I'm seeing a kiddo like from like, with trauma from when they were little, or, trauma from separation or divorce, that we kind of process through it and resolve the trauma like in that developmental stage. But then maybe they become teens and they understand relationships differently and they need to get back in because the trauma is kind of coming back up, right? That's so common. And I think we're understanding that kind of mental health maintenance is similar as like physical health maintenance. But it's not a bad thing if like kids need to do a check-in, every season, or if kids need to do a check-in, when they enter into like a new developmental phase. Like that's so normal. And it doesn't mean that their treatment didn't work. It doesn't mean that they, are still really suffering from the trauma. It's just kids change and kids understand things differently, and we need to keep up with that.
Yeah, because our environments are changing every day. So
yeah, totally.
Wow.
Totally. Well,
I really liked all of that. I think that was very valuable for a lot of people.
Good. Hopefully.
Yeah.
I know with all of this, it's about like giving enough information, but not giving too much, because it can get really, confusing if we dive too deep into it. So if anybody wants to learn more or, understand more, talk to me. They're always welcome to reach out to me. I'm happy to boost up their knowledge in this area, or, if they have specific questions on things that I said, I'm happy to talk with people on an individual basis about that. So you're welcome to reach out to me.
Awesome. And do you have a website? Where can people find you?
Yes, I do. So my website is familyforwardtherapy.com. And my email is it's Logan, Logan, at familyforwardtherapy.com.
Okay, awesome.
And if you go on the website, there will be a link to my email. So they can email me directly, or they can email me through the website, whatever works best for them.
Okay, awesome. That will be in the description of this episode as well. And
perfect.
I hope everyone got a lot of value out of that. I definitely did. And I definitely want to keep you in mind for any future things having to do with families and children, kind of like that, like what we were talking about before we started getting into this.
Yes. Yes.
So I hope everyone had a good experience with this, and I hope you guys have a good day. Please like, review, share, and subscribe to this podcast, and follow us on Instagram at GetSmartWMoney Podcast. as well as checking out our website at getsmartwithmoneypodcast.com.